And now for a word from our sponsor, CVS Health. We are going to show a short video, and then we will be joined on stage by Marissa Rogers, Executive Medical Director of Oak Street Health, in conversation with Joe Ruffalo, the SVP and General Manager of The Hill.
Oak Street Health is celebrating 10 years of helping older adults live healthier lives. Our innovative care model has reduced hospital admissions and emergency department visits among older adults by more than 50%. Every center we open is an investment in the health of our patients as well as the local community, serving as a hub for activities, events, and educational workshops. In just 10 years, we've gone from providing care for a small group of patients to saving lives and improving the health of over 250,000 older adults. And by the end of the year, we will have grown from a single center in Chicago to over 200 centers in 25 states. Everyone deserves great health care, and that's why we're rebuilding healthcare as it should be.
Great. Well, Dr. Rogers, thank you so much for being here today. We just heard a lot about the future of aging. People are living longer. We hope they are living healthier as well. Oak Street has been focused on this idea for quite some time. Can you tell us a little more about the model itself?
Absolutely. So we are a national organization that provides comprehensive primary care for seniors. We're in 25 states. It's really interesting. We just opened our 200th center on Tuesday, which is really exciting for us. So I think the panel below really talked about a lot of the challenges of caring for senior populations, the social and medical factors. Our model is designed to address all of that. So we really do three things very differently. One is much more time with patients. Two is robust care teams. And three is being very proactive around engagement with patients, outreach externally outside of the office. So for example, our providers have a much smaller panel size than in traditional primary care. Our providers, which consist of physicians and nurse practitioners, have about 500 patients to manage, which is about a quarter of what you see in fee-for-service medicine. So we're able to see our patients much more frequently and much more in depth and get to know them and build that trust and relationship, which is really critically important. We also recognize it's not just about medical care. We really do have to address the social determinants of health, be that transportation, food insecurity, social isolation. So we do screen for those things, as well as have social workers on site at every location, behavioral health specialists, and community health workers to really comprehensively address not just medical problems, but social and economic barriers to care as well.
Excellent. What does VBC or value-based care mean at Oak Street? Have you seen lower cost and better outcomes? And how does the integration with CVS Health impact that?
Yeah, so value-based care, as you know, can mean a wide variety of things. For us, it's a full risk model. So we are accountable for the care that's provided inside our centers, but also the care that's provided outside, whether that's emergency rooms, hospital visits, or specialty care. So we really want to manage primary care as proactively as possible to decrease those downstream outcomes. So we're able to get the full risk model allows us much more resources to put into primary care. So we, on average, put 2 to 3 times more resources than traditional primary care, and we're able to do that because of the value-based care model. The outcomes we've seen are decreased in admissions by 50%, decrease in ED visits by 50%, and readmissions by 40% compared to the Medicare benchmark. The CVS relationship really is about helping us grow. So I mentioned that we reached 200 on Tuesday. Next year, we'll open 50 to 60 more centers. So it really allows us to expand our model to communities that need it. Our model is a model where we are mostly in low-income communities. Almost 50% of our patients are dual eligible for Medicare and Medicaid. So we're talking about a high-risk population with, on average, 4 to 5 chronic diseases, and about half of our patients do have a behavioral health diagnosis.
What are the biggest challenges in terms of providing primary care for aging populations?
I think the challenges are many of the things. That panel before was a really nice tee-up around the challenges. I think specifically because many of our patients are low income, it's not really just about the medical care itself, it's about all of the other factors. So we're very intentional, certainly about screening and diagnosing and treating medical conditions as aggressively and early as possible to decrease complications. But we are equally aggressive around screening around social determinants and determining solutions, whether that's partnering with our social work to help identify benefit opportunities, whether that's having our community health worker connect with resources in the community, such as senior centers. All of our centers, and I think that clip where patients may have been dancing, all of our centers do have community rooms in them. So we actually have activities for seniors to combat social isolation. I think that was a great call out previously around the impact on morbidity and mortality that we saw with COVID because of that. We want our patients to be able to have safe places to come in, do Tai Chi, do yoga, listen to music, whatever the community is interested in. We have a group of folks who put on activities, and sometimes those are a part of my prescriptions for patients, not just medications, but I'll get out the calendar of events and we'll go through it and circle which ones, which is really about helping them be well and engaged, which we know is critical for healthy aging.
Very nice. You talked a little bit about behavioral health care, and obviously that has a huge impact, particularly on seniors. What are you doing at Oak Street around that?
Yes. So we screen routinely for depression, which we know is the most common behavioral health disorder in our population. We want to be able to detect it as early as possible. On site, we have behavioral health specialists who are licensed clinical social workers who can engage in one-on-one therapeutic relationships. We also have psychiatric providers who provide extra telehealth support and can do complex diagnosis, medication management, and help us partner to really advance and treat behavioral disease.
There are several chronic health conditions impacting seniors as well. How do you approach their needs?
Yes, so what we are seeing in our patient population is a lot of the risk factors that lead to cardiovascular disease. So a lot of hypertension, a lot of diabetes, a lot of chronic kidney disease. What we are doing is being very aggressive about screening and treatment. We have diabetic protocols where we partner with our nurses who are all trained in diabetic education. For our patients that are high risk, we also use pharmacy partnerships and our PharmDs to help do medication management and telephonically. So we are very proactive about managing chronic disease and trying to get it to control before it becomes complicated. I'll leave it there.
Yeah. Well, as you look at the health system over the next few years, what are you optimistic about?
Well, I'm optimistic about the trend towards more value-based care. I do think we know that we spend a lot of dollars on healthcare in our country, and we don't get the outcomes that those dollars often that we should from those dollars. I also think that models like ours highlight the need for more spending in primary care. Most of the healthcare dollars are unfortunately treating complications and addressing specialty care as opposed to primary care. I think models like ours have shown that if you invest in primary care, you can actually bend the cost curve and decrease the things that are main drivers of the healthcare system, like hospitalization. So I'm excited about that transition. For Oak Street as well, I'm excited about our continued growth. I think that our model has been very well received amongst patients and the communities we're in. And so we're really excited to continue to spread to more communities.
Awesome. Well, Dr. Rogers, thank you so much for your time today.
Great. Thank you.
Thank you.